People are really busy today, but they find themselves devoting most of their time and energy to work, to their family, to their friends, and they forget about themselves. So the mere fact that they escape for a few minutes, for an hour, once a month, once a year, whatever it is, to do something for themselves is in itself incredibly rewarding, and it's a catalyst for other good things in their life. Hi, I'm Dr. Chasin. I'm the Medical Director of Reflections with offices in Livingston and Martinsville, New Jersey. What excites me about cosmetic medicine is making people feel really good about themselves. And that begins with forming a relationship with people, really trying to understand what it is that they may feel uncomfortable with or what they want to see different. And making small changes at times has huge benefits. As people start to feel better about themselves, it affects every aspect of their life. They become more comfortable, they become more confident. They find new friendships, they find advancements at work. This is a catalyst for so many parts of their life, and there could be nothing more rewarding than to be able to help people achieve this. Every patient visit to me is an opportunity to educate people. And my feeling is we're trying to empower them with knowledge for them to make good decisions about their cosmetic care. I don't like being the one deciding what to do with a patient. I want to know from them, well, what bugs you? What would you like to change? What would you like to tweak? That really is how we make people happy in the long run. Sure, I'll give them my opinion. I'll give them a sense of what people see when others look at them. But this really comes from within. This is a personal thing. And we really want to develop that relationship where people are comfortable telling us what bugs them, what they want to change. I don't want it to be something that other people notice has happened. I want it to be under the radar. I want it to be natural. So it's not uncommon that I'm slowing patients down, that I'm telling them no, that I'm telling them less is more. That's what I've become known for. And sometimes it angers people because I won't do what they're asking to do because it won't look natural. And there's a trust and a respect and a dialogue that happens. And my job is to educate them, however, and for them to make an informed decision. We do a lot of things here at Reflections, but each of our physicians has a few different categories of procedures that they really enjoy. For me, the injectables are one of the things that I really enjoy doing. People sometimes see these injectable treatments as the product itself. I had a Restylane treatment, I had a Juvederm treatment. The reality is, these are just tools. It's really how we utilize those tools that makes the result. A good result, a bad result, a natural result, or unfortunately, an unnatural result. And, I equate it with a painting. I say, well, is it the paint that creates a fine work of art? No, it's the painter. Is it the wood that creates a fine piece of furniture? No, it's the carpenter. So very important to look at how things are being done, not just the product that's being used. And patients are really good about educating themselves. They're online, they're reading, they're on Real Self, they're looking at reviews. But don't just look at the product, look at the process. That's really important. For me, using an injectable agent and getting a good result is one that you can't tell that's been done. So I don't want to see someone have enlarged cheeks or lips that don't match the face. I don't want you to be able to tell what's happened. I just want people to look more youthful, more rested. For a relative or a friend to compliment you on your hair or the makeup you're wearing. Nothing about, well, what happened to your cheeks or your lips look good? That's not a good thing. So we really believe in a natural appearing outcome and something that you can feel really confident and happy about. Another one of the areas that I love is body contouring. Well, what is body contouring? Body contouring is using technologies and procedures to change the shape of our body. So that may be reducing fat, that may be tightening skin, that may be treating cellulite in the skin. Body contouring itself, in terms of fat loss, has something that's exploded over the last decade. Years ago, we only had very invasive treatments, and they were done under general anesthetic and required lots of downtime for patients to recover. Now we have even non-invasive treatments, things like cool sculpting, sculpture, liposonics, Exilus. These are no downtime procedures that can cause fat reduction. They take a series of treatments. Patients go right back to their daily life after treatment, and it's something that yields great amount of satisfaction. Minimally invasive treatments, what we call laser liposuction, smart lipo, are treatments that only require one visit. And here we are able to reduce fat, short amounts of downtime, and we actually do this while patients are awake. Local anesthetic. So that's rapid recovery, less risk, less cost, all good stuff. The best thing about body contouring is not the treatments, it's the fact that these things are a catalyst for patients. Once they have a body contouring treatment, it seems that they respect their bodies better. They exercise more, they eat better, they're more active. So it really creates a change in someone's life. That's the exciting part. We have over 50 lasers at our practice in Reflections, and practitioners, colleagues, they ask, why do you have so many devices? And patients, they walk through and they're just startled by how many different lasers we have. Lots of reasons. Number one, safety. Number two, efficacy, how well they work. Number three, which is the most important, we're able to tailor our treatments to our patient's needs. A patient may come in and they have darker skin. The next patient may have lighter skin. Well, guess what? There's not one laser for a given application that can treat those two individuals. So by having the right device for the given patient's skin type, we can use a device that's going to be safest and most effective. Even hair removal. We have 4 different categories of treatments for hair removal. Light skin, dark skin, coarse hair, thin hair. Each require different lasers. So if a patient walks into a practice for hair removal and they have one device, the odds are they're going to be compromising their care and increasing their side effects. So really important to look for a variety of technologies for whatever you're treating. Tattoo removal, another example. There's green tattoos, there are black tattoos, there's red, there's yellow. There's not one device that can treat all those colors equally well. We have a Q-switch YAG, a Q-switch Alex, a Ruby laser, a Pico laser. Using all these tools, we are absolutely targeting the color best. We're performing the most efficient treatments, safest treatments, and also the most cost-effective treatments because of having these technologies. We have a wonderful team of physicians here at Reflections, and I think we each have a different skill set, probably a different set of strengths, and I think that's terrific in that a patient can be seen for a number of different procedures and always know they're getting the best results possible. Reflections is my legacy. Both the profession of cosmetic medicine and the actual practice here at Reflections has given me the power to be able to help patients discover and rediscover the joy in their life. And in so doing, has given me a great deal of joy as well.